Good morning, Louisiana home care providers. We're trying a new approach to communicating with you from the Home Care Association of Louisiana, and today we're sharing information with you via a web camera. The story that you're getting ready to hear is going to be sent out via our conventional email and on our blog, etc. But we wanted to begin to experiment with the webcam as a way to better communicate with you, hopefully in a quicker manner related to some of the issues going on in the industry. We certainly will have our share of challenges in the coming year, and anything we can do to better communicate with you hopefully will give you an opportunity to make more informed decisions related to what's going on in your home care organization. While the cuts for Medicare home health from the Affordable Care Act have got most of our attention over the past months, increased scrutiny by the federal government has a much greater immediate threat to home care providers across the state that focus primarily on Medicare patients. The Healthcare Fraud Prevention and Enforcement Action Team, which we've called the HEAT, has been active in the Baton Rouge area. Many of you already read about the 31 people that were arrested in the Baton Rouge area on July 16th of 2010. In the past 2 days, one of those people has pled guilty, and 4 others are due to go to trial this coming week in Baton Rouge. These defendants have been accused of recruiting Medicare patients, illegally sharing Medicare numbers with providers, who in turn found physicians, 4 of whom were indicted, to sign those orders, and then those companies provided care to patients that was questionable care, questionable supplies and equipment. So we'll be watching that closely this coming week. That trial is due to start on Monday of this coming week. Another area of increased scrutiny that providers need to be aware of is the zone program integrity contractors. Louisiana's ZPIC contractor is Advance Med, who has already been active in Louisiana in the past weeks. HCLA has information that providers in the Monroe area and in the New Orleans area have already been asked to submit information to the zone program integrity contractor. Advance Med is our zone program integrity contractor for Louisiana. They were recently cleared to become active after a delay that came as a result of a legal challenge by another company who was hoping to get that contract as the ZPIC. Other ZPICs have already been very active in Texas and Oklahoma. Expect to see a lot more activity from the zone program integrity contractor here in Louisiana. Their website indicates that they now have an office here in Baton Rouge. Advance Med's program director, by the way, Curtis Watkins, has agreed to speak at the HCLA annual conference, which will be in Baton Rouge. He'll be speaking on November the 3rd. Providers are also likely to begin to see more activity from the fiscal intermediary. Those of us that have been around for a while know that on occasion we have a period of years where we don't get much requests at all for additional development from a standpoint of documentation and claims, and then all of a sudden we see an increase in activity. We anticipate increased activity because they are seeing more activity from NGS. National Government Services is the fiscal intermediary for a number of states, including Michigan. Industry analysts have seen a lot more requests for information from there, and they feel that the other fiscal intermediaries will be hard-pressed to increase their own scrutiny if one of the fiscal intermediaries has increased their activity. Those of us who were around to experience BBA 97 know the industry was not only squeezed by changes in the payment system, but also had significant denials as a result of intermediary review of documentation that was deemed insufficient. Overpayments from providers to providers were not able to be repaid in a lot of cases, and as a result many agencies closed at that time. Considering the increased conversation about PT utilization since Senate Finance and Securities and Exchange inquiries, industry insiders expect therapy to be a big area of interest for Palmetto GBA and other fiscal intermediaries. Lastly, this week, Amedisys, whose corporate office is based in Baton Rouge, received a request for information from the Department of Justice asking for claims information and other business documents dating back to 2003. Amedisys has grown to be the largest home health provider in the nation, and predicted revenue of $1.63 to $1.65 billion this year. While business models of most providers across the country vary greatly from Amedisys, certainly the increased scrutiny that they're receiving will almost certainly result in a more conservative approach for all providers and greater attention being paid to our compliance plans. We hope this information is helpful to you. Please look for more similar communication from HCLA in the future. And we appreciate your involvement in home care and certainly hope that we can continue to help you to provide better care and to do better at your business. Thank you.